Welcome to Caring Adults Tackling Youth Vaping. This virtual educational video is intended for Talawanda school and district staff, public health or medical staff, parents and caregivers, coalitions, community leaders or members, and youth serving professionals who are asked to support prevention efforts on youth vaping. The video will provide an overview of the youth vaping epidemic, the role that caring adults play in vaping prevention, explain trusted adult principles to reach your conversation goals, list resources, and a call to action for the ways you plan to support youth moving forward. Let's begin with our topic, youth vaping. Electronic nicotine devices and/or e-cigarettes are known by many different names. Some are e-cigs, e-hookahs, mods, vapes, or vape pens, and all are electronic nicotine delivery systems, or what we call ENDs. The use of an e-cigarette is referenced as vaping. They are electronic devices that heat a liquid and produce an aerosol or mix of small particles into the air. Many vapes come flavored and are chemicals not safe to inhale. Note their different shapes, sizes, and appearance are like regular cigarettes, cigars, or pipes. Even common objects like USB flash drives and pens. E-cigarettes contain nicotine. We know some product labels do not disclose that they do, and some vape liquids have been marketed as containing 0% nicotine, even when found to contain some. More importantly, no matter the amount, nicotine is highly addictive and can harm adolescent brain development. Scientists are still learning about the long-term health effects of vaping. Now that we have explained what youth vaping is, why don't we begin with the reflection? Take a moment to follow the prompt on the screen and answer the question. Why do kids pick up tobacco and nicotine products? According to the American Lung Association, some reasons kids pick up tobacco and nicotine products are peer pressure. Their friends encourage them to try it and to keep smoking. Teens who observe their caregivers smoke interpret that behavior as permissible. Believe everyone else is smoking and that they should too. Keep in mind most teens are not engaging in this risky behavior. The tobacco industry has used clever marketing tactics to specifically target teenagers. In fact, the industry presents smokers in images that appeal to teens in ways that seem cool and attractive. In places where low tobacco taxes have kept the price down, means it is easier for kids to afford tobacco and nicotine products. Note that most kids have never tried tobacco or nicotine and say they won't. Nicotine is a feel-good drug without intoxication. Teens don't realize how highly addictive nicotine is when they try it and how difficult quitting can be. The most common reason youth say that they continue to use e-cigarettes is feeling anxious, stressed, or depressed. We know youth e-cigarette use has been associated with mental health symptoms such as depression, creating a cycle of nicotine dependence, which is a source of stress worsened by withdrawal symptoms. They may keep using tobacco products to help relieve these symptoms. Ultimately, the majority of adult smokers began smoking before age 18, and many were addicted before completing high school. It is critical as caring adults to learn how to approach youth and utilize best practices for responding to tobacco and nicotine use. Let's look at some data regarding the youth use of these products. Recently, e-cigarettes was the most commonly used tobacco product, and among current users, they reported using a flavored one. According to the annual National Youth Tobacco Survey, 12.6% of high school students and 6.6% of middle school students reported current use of a tobacco product. It may seem like all young people are vaping, but the numbers here don't support that statement. To reinforce the choices we do want to encourage, we suggest you reword these data points to focus on what percentage of youth are making a healthier choice. Like this: nationally, 87.4% of high schoolers and 93.4% of middle schoolers do not currently use a tobacco product. Did you notice how that sounds more affirming? How does this compare to Ohio? The 2021 Youth Risk Behavior Survey results show 35.1% of high school students and 16.6% of middle school students ever use an electronic vapor product. But what happened next? The numbers of those who currently use decreased to 20% of high schoolers and 9% of middle schoolers. So what does that tell us? Even though they tried it, most did not continue to vape. The data supports the healthier decisions young people are making. So when presenting these numbers, we would want to say 64.9% of high school students and 83.4% of middle schoolers do not use these cigarettes. Most youth are choosing not to use these products. This may be surprising when we hear about the vaping epidemic. We assume most young people vape, and they may draw that same conclusion too, which makes them feel that vaping is normal. The power of feeling something is normal is that it can influence people towards certain behaviors. If you hear young people and adults say everyone is vaping, Be careful not to accidentally confirm that this is true, because it is in fact the opposite. What surprises you about this data? The role of caring adults can help even more young people remain tobacco nicotine free or have those who are currently using a vape quit. Did you know that most students who use tobacco products want to quit and have attempted to do so? Caring adults are approachable and connect with young people. Connectedness is a protective factor that helps youth avoid risky behaviors. They encourage open conversation about risky situations. Teens aged 14 through 17 do feel they can talk about things that really matter. Caring adults engage young people in critical thinking about the predatory tactics of the tobacco industry. They reinforce most youth aren't using tobacco products and share the data that youth are making healthier choices. And they share reliable resources for health information and quit support. Getting help for nicotine dependence is okay. Check out those apps and quit lines. Caregivers can set a good example. Stop exposing the child to secondhand smoke or aerosols from tobacco products. Tell your child explicitly to stay away from all tobacco products, including e-cigarettes, and share quit resources too. Educators can help young people develop healthy coping skills. Teach refusal skills to use during social pressure. Discuss the health effects of vaping. Encourage you to talk with a trusted adult for support. And healthcare providers can ask about e-cigarettes when screening patients for the use of tobacco products, and warn about the health effects of all forms of tobacco and nicotine use. Skills-based communication are essential to use in your interactions with young people to reach your conversation goals. Keep in mind to adjust verbal and nonverbal techniques to be culturally responsive to communities that are different to your own. The foundation of having a trusted adult conversation is reflection. Consider your own point of view, ability to be a role model, the current status of the relationship to the young person, and the context of the conversation. When young people make statements or ask questions, there may be something driving the type of support they need. Determining the underlying concern can help you decide how to guide the conversation and move forward. To help structure this conversation, use the acronym OR, which is an acronym that stands for Open-Ended Questions, Affirmations, and Reflective Listening. This approach can help you use the skills of being a trusted adult in conversations with young people. Open-ended questions are a technique that keeps the conversation moving and allows the young person's voice and opinions to drive its direction. The question can't be answered with a yes or no. Asking open-ended questions allows young people to develop skills for refusing these products if they come across them in a social situation when you aren't there. Affirmations are ways to focus on the strengths young people have and build self-efficacy. Make an effort to focus in on the positive behaviors they have displayed, even if bringing up the conversation with you is the most positive behavior you observe. Be sincere, and affirmations should be true and genuine to have an impact. Reflective listening is an important way to build trust by showing that your focus is to respond to a young person's needs. Part of caring adult conversations is being able to provide accurate information to a young person if they need it. But as we have learned, much of this conversation is about letting the young person lead. Use ask, provide, ask approach. Ask if they want accurate information, provide it, then ask what they think about what you shared. Be sure to include the health effects of vaping, laws, or policy implications. Now that you have learned approaches and techniques to holding caring adult conversations, here are some resources for your community and the young people you serve. Remember that connectedness is a protective factor against risky behaviors. Building trust with young people before you have a conversation about a topic like vaping is important. If you haven't shown curiosity about a young person's life, practiced in just listening, or honored the things that matter to them, it may be a challenge to suddenly become a caring adult in a moment's notice. Use the conversation goals to strengthen those relationships. Here are some tips for conversations with teens. Keep the conversation going. A good approach is to listen, ask questions, and be supportive. Just because youth may ask about vaping doesn't mean they're doing it. Take a moment before answering, especially if you know you may be reactive. Timing is important. Where is your young person's attention, and when are these conversations happening? Keeping the touch points quick is more effective than long sit-downs. Make the conversation relevant and not random by bringing up vaping out of the blue. It's okay to not know things. Acknowledge you may need to find out. Here are some healthy ways teens cope with anxiety and stress. Quitting vaping can improve overall mental health. Breathwork helps one concentrate on interrupting anxious feelings. What people, places, and things trigger and makes you feel anxious? Write it down. Notice any patterns to disrupt. Moving your body helps release chemicals in the brain that make you feel better. Self-care is a reminder to eat, snack, drink water, sleep, and try to lower stress. Focus on what you can't control in the moment. Get in touch with those who care about you, make you feel better, and can help you stay vape-free. When anxiety or stress feels severe, call a hotline, text, or chat with a counselor. Talawanda School District is committed to providing educational resources to youth who have a tobacco policy infraction and implements a tiered response student support protocol. As recommended by Best Practice, Second Chances, an online nicotine education program uses an alternative to suspension for middle and high school youth. Quit support services are offered to youth who express needing help with their nicotine dependence. The role you can play is asking a young person whether they want to quit. If not ready, a quit service will not be effective. But if they are, a teen can enroll in My Life, My Quit by text, phone, or visit mylifemyquit.com. They aid in creating quit plans, how to identify triggers or address cravings, and practice refusal skills. Please keep in mind Ohio's parental consent laws. Let's use what you've learned from the video and put it to action. Take a moment to think about your next step. What will you immediately begin to put into practice as a caring adult to tackle youth vaping? If you need further support, please reach out to Amy Masechko, Health and Wellness Coordinator, by phone or email. RMC Health is proud to partner with Talawanda School District to support your efforts in keeping teens vape-free. RMC Health provides professional development and capacity building to empower adults in supporting healthy young people thrive. Feel free to contact us to learn more.